Good afternoon. Thank you for coming in. Did you get all signed in? Okay. I was just taking a look at your chart, and it looks like we're starting a physical therapy routine for shoulders. Can you tell me a little bit about what happened? Okay. And is this something that's gotten progressively worse over time, or is this more of, with a change in the weather, it seems to get a little bit more noticeable? Yeah, I understand. Well, let's go ahead and just get right to it. Do you mind if I do a little bit of a general assessment with you? Okay. What I'm going to be doing is just taking my hands and very lightly palpating in different areas around the shoulders, up to the neck, and down like your biceps and your triceps. And even though it's primarily pain that you're experiencing in your shoulders, the concern is that you might have muscle strain in other areas too. Okay. Also, any other activities that you've noticed? Do you work long hours staring at a monitor? Do you find yourself sitting in certain positions or with different pillows? Okay. We'll talk about pillows a little bit afterwards. I think that can also be something that you may not be aware of that could definitely contribute to it. Okay. I'm just going to sanitize my hands first. Just relax. Sit normally. Just going to start by palpating your neck. Have you had any kind of cold lately? Any other inflammation? How about things like fibromyalgia, anything like that? Autoimmune disorders, anything? Okay. Alright. Just gonna place my hands on the top of your shoulders here and push down a little bit on a scale of 1 to 10. 1 being non-existent, 10 being the worst pain you've ever experienced. With this amount of pressure, what do you gauge this? Okay. So not that bad. Okay. Now, I'm going to instead push inward. Could you tell me, how about this? A little bit more? Okay. Okay. I'm going to take one arm at a time. Try and maintain your balance upright. And please just allow me to maneuver your arm here, okay? Okay. And at this height here, what would you grade this? I'm going to move your arm forward. Okay. Rotate over. Okay, I can see you're wincing a little bit. Okay, I'll do it a little bit slower, and you tell me at what point that gets to be beyond a tolerable, like if you had to experience that level of discomfort continuously, and you tell me when it hits that point, okay? It's just starting at a neutral position, slowly elevating your arm. There, okay. Okay. And between here and here. Is this a smooth transition between where your arm is? Okay. So it's once it goes beyond that point, then you notice it more. Okay. Go ahead and just relax. Use my hand and I'm going to sausage your arm a little bit. see whether or not if you have any elevated temperature. Okay, does this all feel like acceptable? Okay. Do you experience any additional pain here? Okay. So the muscles feel. Okay. Well, I think if you're experiencing joint pains, it's very common that your muscles are going to try to take on the extra burden of that. And so that's not uncommon at all for them to be sore. Okay. I'm going to do the same with your right side. Okay. Just going to first straighten your arm all the way out. Okay. And how about out? Does it? Okay. Back down. Okay. Is this your dominant side? Okay. Okay. I'm gonna go ahead and do the same here. Okay. All the way up. Okay. And do you notice that this is symmetrical? Is it more painful on your left or your right, do you think? Okay, try that one more time. And again, just let me know when I get to the point where it's too uncomfortable, okay? Up. Okay, here. Okay, just a little bit more. Okay. And then beyond here. Okay. Go ahead and rest your arms for me. So I'm going to move my hands to the back of your neck. Just going to kind of feel how these muscles here in your neck are behaving as a response. Is it okay if I maneuver your head? I just want you to rest the weight of your hand, or rest the weight of your head in my hands, and let me just manipulate your neck a little bit. I want to feel how the vertebrae are all rotating in comparison to when you're stationary. So I'm going to first start by tilting your head down a little bit. Okay. All right. And any discomfort there? Okay. And then back up, looking up. Okay. Now with your head raised, feel around the back of your neck here. Okay, just hold it right here. I'm going to feel your vertebrae on the side here. Does any of this pressure that I'm applying here, does this cause any notable level of pain? Okay. I'm going to do the same here. I'm going to rotate you to your left. Okay. Okay. And just stretch. Okay. And do you usually use anything like a hot or cold compress? Okay. How about any medications? Okay. Go ahead and tilt your back here. couple of different things that I'd like to also do is I also want to take some resistance bands to give you some exercises specifically to strengthen the muscles in your shoulder. And this is going to include where you grab this however you're comfortable. I usually grab with a fist, hold it to your chest here, and then just extend your elbow out. Don't let your elbow drop. Don't turn your arm like this. You want it to be out straight. And just extend this way until your arm is all the way out. We'll do the same on the other side. And what you're going to feel with this, is this entire muscle right here, all the way up to the back of your neck. You're going to feel that elongate a little bit differently than when you're pulling weight towards you. Okay. So go ahead, I'm going to guide you here. So just hold it to your chest here in center. Okay, level your shoulder here. Okay, go ahead and extend. Okay. And I want you to just go ahead and extend your arm, lock your elbow, and just hold it there. How do you feel right here in your chest area? That nice stretch that's going on right there? Okay, yeah. I'm going to feel it in this area. Okay, this is a bit different resistance than when you're picking something up. Does this feel as painful as it does if you were to say pick up a heavy object? Okay, it's a little different, yeah. We want to stretch these muscles out. We also want to create a little bit more strength. So let's go ahead and bring that band back in. Okay, go ahead and rest. And let's go ahead and do the same on your right side as well. Just hold here. Go ahead and stretch. Okay, bring it back. Yeah, we'll give you a little bit more slack right here. I'm just trying to warm up the muscles at the moment. Okay. Okay, good. I'm going to do the same where you're going to extend this all the way out. And just hold that position for a second. Go ahead and if you flex your shoulder back a little bit more. Okay. Again, do you feel this area right here where that's really nice? Yeah, that stretch feels good. That's the kind of muscle that we want to be flexing right now. Okay. All right, go ahead and let that down. Okay. Go ahead and just wiggle your shoulders a bit. Okay. Now I'm going to do the same thing to you. I'm going to move your shoulders up and down. So go ahead and just relax. This is going to be me. Essentially what I'm going to be doing is rotating this area, just freeing up some of the tissue. And this is not intended for you to resist. We just want to keep on moving that area. So go ahead and just relax. And let my hands and arms do the work, okay? Okay. Okay, gonna lift up. Lean back in the chair, and I am going to pull your shoulders forward. Okay. Okay, just tilt your head back maybe. Yeah. And we're just getting the stretch in. Okay. Okay, go ahead and relax. Take a deep breath in. That's a little painful. I'm so sorry. Okay, we'll be a little bit gentler. Let's do this just a little bit at a time here, okay? So I'm going to just Just lift up your shoulders very gently and slowly. Okay. And then back down. Okay. I'm going to again rotate here. I'm going to take both of my hands. I'm going to cup one side on the back and one side on the front here. We're just going to focus on making the shoulder a little bit more loosened up here. Bringing some attention to not only the joint and the ligaments, but also the muscles. A little bit of circulation. Relax. Your right side here. So just try to let your arms fall nice and heavy. All right. We're going to focus on a little bit of stretching in your neck area here. And this is a muscle that often will pick up the slack when you're not able to carry the weight of your arms properly. Your other muscles are going to struggle to try to compensate for that. So I'm going to start by, again, rotating your head to one side. And I want you to just go ahead and tilt your head to the side as much as you can. As close to resting your head on your shoulder as you can, okay? Is that good? Okay. So for this, I'm just going to use just a gentle squeezing action here. I'm not going to do just using some light compression, just squeezing the area here. I'm not doing anything like an effleurage massage or anything. Do you typically get a massage? I can make a recommendation if you like. Yeah. It certainly would not hurt, I think, massage in general. Even if it's not for anything particular. It can always be beneficial to your body. Just gonna squeeze and hold this for a little bit longer then. Okay. Is that okay? Okay. Alright, go ahead. Let's get you back up. Okay. Does that feel a little bit better? Just about? Okay. You can definitely feel that the muscle is a little bit warmer here. It's not just locked up. Are you ready for your right side? Okay. Go ahead and just position your head. Try to rest your head on your shoulder if you're able to. Is that okay? Okay. we could do massages here as well. So, do you want me to go ahead and get you booked for that? Yeah, I mean, if it's not aimed at just your shoulders, it can help with your lymph drainage, it can help with circulation, breaking up fascia. Overall, it's good for your well-being too. Not to mention it feels really good. Okay. Again, I'm just going to hold the squeeze here a little bit longer. How does that feel? On a scale of 1 to 10? Okay. Let's go ahead and get it back up. I'm going to send you home with some resistance bands, and I do recommend, especially with the outward motion, where you're extending your arm, holding it there. You don't have to have a lot of tension on the band, and grip it as far or as close so that you have a heavy amount of tension, or if it's lighter. Obviously, that's going to just depend on your pain level that day too. Once that builds up, we're also going to feel it loosen up the neck muscles towards the back. I'm going to take a couple of minutes here just to kind of rotate your head, because despite the problem originating with your shoulders, you do carry a lot of that tension, especially at the very base of your neck. So, I'm going to get a little bit close to you here. And I'm going to place my hands underneath your ears, so right here. And I'm going to go ahead and lift just a little bit. I want you to go ahead and just let your head fall very heavy in my hands. Okay? Please let me know if there's anything that's just too much and you don't feel comfortable. Just hold it right there. Is that a tender ankle? Okay. Okay. Okay, I'm going to go ahead and push just a little bit farther. Okay, how about now? Okay. Okay. Let's go ahead and back up. Okay. Down to your right. Stretch that muscle down. Okay. Do you notice that the pain is more on one side than the other? Okay. Just looking straight up here. Gonna elongate as much as we can. Go ahead and look at the ceiling. Okay. Just a little bit more. Awesome, okay. Just hold that for a second. We're gonna rotate a little bit in each direction. Okay, do you feel that this is like sticking in any direction? Good, good, okay. Alrighty. And back to center. Does that feel a little bit better? What time of the day, what days of the week would feel good for you as far as following up for a massage? Okay. let's see if we can work you in on that, and that way we'll take a little bit more of a relaxed approach to circulating the area, just general well-being. In the meantime, do those exercises and those stretches for your shoulders. Okay. Well, I look forward to seeing you in a couple of days then. Okay. You take care.